Hello and welcome to this special interaction. Today we'll be going across live to Nishant Pandey, CEO of American India Foundation. Nishant, thanks so much for speaking with NDTV. We've been hearing and listening to some incredible work being done by the foundation and how the NRIs staying so far away from the country still doing so much in India's hour of need. Take us through what compels them, what's bringing the community together to help India at such a crucial time.
Thank you, Sonal. Thank you. And thank you for inviting me. Absolutely. I think, this was a moment when India needed support from the global community, and the community really stepped up, especially Indians living all across the world. I think there are 2-3 reasons why the engagement levels were so high, and they continue to be high. First of all, it's a global pandemic. Everyone was affected by it. I mean, we have to remember that, unfortunately, US and India share the top 2 spots in terms of countries affected by COVID-19. I live in New York City, which I'm sure your audience knows was a hot spot last year. The situation was really bad in New York City. And so this was not something that was happening to people, 10,000 kilometers away, and we had no idea what it feels like to live through this pain. And so people could relate to the anxiety and the nervousness that people in India were going through. So it was a kind of a relatable issue. The second thing is, of course, over the last couple of months, I struggled to find anyone within my network who has not been affected by COVID-19 directly. I'm talking about people who live in the US, for example. Either they have lost a family member or a friend, or their families and friends were directly involved in taking care. So again, it was something that was affecting people personally here. It was again not something that was happening to other people. And also third thing I think is very important. And I must say that a large part of the support that we have got has come from non-Indians, because I think the global community realizes that this pandemic is not over until it is over in India, given the population of India, given the connections that the Indian population has with pretty much all of the world. I mean, look at how Delta variant, which was first spotted in India, is now dominating cases in the UK. Dr. Fauci yesterday said in an interview that the Delta variant is probably the largest, the biggest threat that US has in its fight against COVID-19. So this pandemic is really not over, and everybody has a stake in what happens in India.
Yeah, in fact, you're absolutely right on that front, divided by boundaries and countries. But at the heart, this pandemic has really hit us all. It's been such a leveler to start with, and how it's impacted people and lives all across. Then tell us a little bit about how exactly the NRI community came together, and what kind of help have you managed to give in so far?
Yeah, absolutely. I think it was, we were quite humbled by the outpouring of support. And that support continues. A lot of people, doctors, engineers, people in the supply chains, corporate sector, everyone literally, and I'm including non-Indians as well, just kind of stepped up to this challenge, and they were doing everything that they could do in their power to help India in this hour of need. A lot of people stepped up and volunteered their time and expertise. Remember, we were dealing with a crisis where, for example, oxygen concentrators which were needed were not available in India. So we had to deal with international supply chains, which are anyway precarious because of the COVID situation. So AI, for example, has imported life-saving equipments from many countries, US being, of course, one of them, but also Taiwan, Australia, China, and other places. And we have worked with a lot of volunteers, people who are experts in managing supply chains, not necessarily for this reason, but in their kind of day-to-day jobs. And so there was a lot of support from people like that, of course, financially. So people, there was also a kind of a sense of helplessness. So I think people thought that probably, funding some of these initiatives could be their way to support. And then thirdly, and very importantly, working with the US government and talking about how US government can step up its efforts to support India, not just in terms of the immediate needs on the ground at that point of time through oxygen supplies and other life-saving equipments, but also in the more kind of medium to long term through vaccination and things like that. So there are various ways in which people stepped up to provide their support.
That's right, and incredible work really. But tell us about how can people actually contribute? How can they help? I believe vaccines are now going to be the way forward, something that India really needs in more and more amounts at this point. Is that an area that you've been working on?
Yeah, absolutely. You know, the stage one of our relief work was focused on securing life-saving supplies for immediate needs. So we have distributed more than 5,000 oxygen concentrators. We are installing 50 oxygen plants across 50 cities of India and building portable hospitals across about 30 cities of India. But we know that the best bet, the only bet out of this pandemic in the more medium to long term is vaccination. And so that's why we have worked with the government of India, various state governments, NGO partners, corporate sector, and many other stakeholders to design the first million initiative. The goal is very simple, to vaccinate at least 1 million people from vulnerable and marginalized communities. We are talking about persons with disabilities, women in the unorganized sector, migrant workers, including street vendors, sex workers, and tribal communities, essentially. The idea is that, India's vaccination drive should not just be fast, and we have seen some improvement in the last few days, but also fair, equitable, and inclusive. It's very important that vulnerable people get vaccinated. Countering vaccine hesitancy, especially in rural and tribal areas, is a big part of this initiative. We know that there are high levels of misinformation and misconception about vaccines in many communities of India.
Brilliant work, really. Thank you so much for everything that you're doing, Nishant, and thank you for speaking with NDTV, and good luck for the times ahead.
Thank you so much, Sonal. And through your channel, I want to thank all our supporters and donors who have believed in the ability of AIF to provide much needed need at this urgent time.
Thanks. Thanks so much, Nishant, for speaking with NDTV.
Thank you so much, Sonal. Thank you.